So something else I really want to talk to you about is home health. I know this is like totally switching gears, but you have a lot of experience in home health. A lot of people want experience in home health, so I want to get some info on that. So, have you always worked in home health, like right out of school, or what was it like getting into home health originally?
So coming out of school, I was in inpatient neuro, but I had heard, I think our exposure in school, I don't know how it is for nursing or other disciplines, but I know for PT, I think our exposure is really minimal. As a matter of fact, one
Yeah.
of the, like a PT student I follow on Instagram, had a home health clinical, and I had never heard of that until
Yeah.
like I saw that, and I thought that was really cool. But the transition into it, honestly, so the reason I got the job was just because like I was pretty set on going to Alaska, so I would probably have worked in whatever setting. But I
Okay.
saw the need for a home health job, and they were welcoming people with no experience, and people that needed to be mentored. So the transition wasn't that bad at all,
Okay.
because home health, essentially, at least from a PT perspective, you're focusing on a lot of the same things that you would do in acute care or in inpatient. So you're focusing on wheelchair mobility, stairs, gait, and transfers.
Hmm.
However, you're just doing it in their environment. And so you have to kind of like, you can use the environment that they're in to facilitate either exercise or how they're going to move. The transition wasn't bad because I'd had experience in inpatient and acute care. So from a clinical and therapeutic side of things, like that's really, it's not that big of a jump. It's just you have to kind of
Okay.
switch gears and shift your thinking. I think in home health, the more challenging thing is, you have to be really organized,
Hmm.
which I'm not the most organized person in the world, but it kind of helped, sharpen that up a little bit. Because basically, like, you're communicating with physicians, you're putting in orders to the physicians to
Hmm.
request like a certain block of therapy, and you're also sending that to the insurance companies. You have to call and schedule patients. You have to keep track of your mileage. You have to structure your day appropriately. So, for instance, like
Hmm.
I can be more efficient with my time if I have, three patients on the same side of town back to back to back. It's
Yeah.
eliminating my need to kind of drive all over the place. So you have to be able to like kind of plan ahead. So I think the challenge in home health is not so much the therapy side of things. It's more of the like all the other things, and
Yeah.
adjusting to that was, I mean, it was a little bit of a challenge, but nothing beats the flexibility behind it too. Like I
Okay.
think absolutely 100% the flexibility that you get with home health is 100% worth like any of the difficulty or the responsibilities that come with it. And I do think, I think I do think in some ways the responsibility side of it is maybe a little bit more than other settings of therapy. For
Yeah.
instance, on a PT side of things, in home health, we have these things called starts of care, which
Hmm.
basically act as us admitting a patient into the clinic. So we're not only going out there and treating them and doing an eval, but we're also going over all the paperwork that they need to go over. And when we do a start of care, when we admit a patient into the home health agency, we're also checking their medications, checking drug to drug interactions. And that's something I had never done before. And that's
Huh.
something that's very much like nursing oriented or
Yeah.
physician oriented. So the challenges that come with it, I think, are less about the therapeutic side of things and more about the other stuff, but absolutely worth it. I mean, I could go on and on and on and on about it, but like I love home health so much because
Yeah.
you like not only you're doing PT, but you're also treating people in their most intimate environment. So, I feel
Hmm.
also like the relationships you form are that much more meaningful, because you're really seeing people like when they're the most comfortable when they're at home. So I love
Yeah.
it. worth any challenges it could bring.